Good afternoon, everyone, and thank you so much for joining us for the AZHCF Healthcare Foundation's webinar to learn more about the Connections for Cardiovascular Health, or CCH, Next Generation Program, and our open call for applications in February. We really are so grateful for your time today and interest in improving cardiovascular health in your communities. My name is Amy Pompey-Pom, and I serve as Secretary and Trustee of the Foundation. I'm joined by several people today: our Board President, Rich Buckley, Board Chairman, Jim Blassetto, one of our evaluation partners from the Center for Social and Economic Policy Research at Westchester University of Pennsylvania, Dr. Jeff Osgood, Executive Director Joyce Jacobson, Program Manager Colleen O'Brien, and Operations and Communications Manager Alex Jackson. During today's webinar, Rich will provide some information about how the Foundation approaches philanthropy through its programs. You will learn about our commitment to improving cardiovascular health through capacity building and creating community among our funded organizations, evaluation partners, Foundation staff, and trustees. Dr. Blassetto will introduce CCH Next Generation, our next phase of grant making, which is based on 10 years of effective program practicing. Dr. Osgood will provide an overview of the application process, including what we look for in a good application and some of the resources available to each of you as you prepare your application. We will then have a question and answer session at the end and encourage you to submit your questions through the question and answer box in advance, which some of you have already done. We will also have a brief poll question for each of you at the end of each presentation, which really are truly designed to help inform the CCH Next Generation moving forward. Please know that this session is being recorded and will be available to you afterwards. So to start, and to really help bring this program to life, we have a short video that we'd like to share. Please make sure that you turn the sound on.
The AZHCF Healthcare Foundation founded the Connections for Cardiovascular Health because we know that cardiovascular disease is the #1 cause of death in the United States.
We're giving these organizations important funding to improve cardiovascular health at the local level.
What we sought to do was to have grants issued to local community-based organizations that could truly move the needle, help people become more educated, improve their wellness and nutrition and their diet, and to truly live healthier, longer lives.
The kids come in and learning about No Hearts Left Behind so they can communicate with their parents about eating healthy, and their parents bring it to the community.
It has completely changed our lives.
It's a pay it forward program because they want to help everybody around them. And if you're the one getting the help, then you want to help somebody else.
It's been amazing to see the foundation grow and to see our grant awardees grow year on year.
Because of the great work they've done, we look to them to share their lessons learned with others to amplify the impact.
Welcome everybody to Buffalo for the AZHCF Healthcare Foundation 2019 Mentor-Mentee Learning Forum. We're really excited to be here this year. I think it's going to be a great opportunity to carry on with this tradition we started of not only having great programs out in the field, but also creating opportunities for the programs to teach one another, to share best practices and learnings.
Let's say, hey, what are the things that are working well in your program that's leading to your success, so that others around can hear that and maybe pick up the pearls that you have to help improve their programs and their disease prevention efforts.
The AZHCF Healthcare Foundation uses its grant-making, management, reporting, and evaluation framework to select applicants with the greatest potential for success and to partner with them to help build capacity. This framework supports grant awardees from the moment they apply through the execution of their programs to their work, sharing lessons learned.
Each of the organizations comes from a different community, different problems and different solutions, and we expect them to go back and to hit their marks, to drive real change, and then more importantly, to come back and share with us what they've learned so that we can help other organizations that are on their journey also improve their mission.
I'd now like to introduce our board president, Rich Buckley, to provide a bit of an overview and give you more details about our program. Our apologies, everyone. We are, as you can probably imagine, experiencing some technical difficulties. So I'll go ahead and fill in for Rich briefly. The AZHCF Healthcare Foundation was established over 25 years ago and is a 501c3 nonprofit entity separate from AZHCF Pharmaceuticals. Okay.
Hi, Amy, can you hear me?
We can, Rich. Over to you.
Okay. All right. Thank you, Amy. Just picking up where Amy left off. So the AZHCF Healthcare Foundation was established over 25 years ago. As mentioned, we're a 501c3 nonprofit and separate from AZHCF Pharmaceuticals. We launched Connections for Cardiovascular Health in 2010 to address the nation's leading cause of death and to help improve cardiovascular health in the U.S., thanks to an initial contribution of $25 million from AZHCF. Since then, the AZHCF Healthcare Foundation has provided nearly $24 million in CCH grant funding, along with capacity building to over 50 U.S.-based nonprofit organizations to help improve heart health in communities across America. And the results have been really astounding. Over 1.7 million people have been reached through the CCH program, spanning 25 states and Washington, D.C., and over 65,000 participants have had their progress tracked towards improved cardiovascular health. Participants have increased their physical activity, they've gained knowledge of nutrition and improved their eating habits, as well as demonstrating improvements in such measures as blood pressure, BMI, and cholesterol levels, just to name a few. But the impact doesn't just stop there. Many program participants are going on to volunteer at the community organizations or sharing their learnings with family and friends so that they may benefit as well. We've watched our grant awardees evolve their programs over the years, and we've grown as well, which has led us to CCH Next Generation, which is our next iteration of the signature program. Next slide, please. The AZHCF Healthcare Foundation approaches philanthropy from a collaborative perspective. We believe that in order to fully realize our mission, we need to do more than just provide grant funding to programs. We also provide our grant awardees with opportunities to help them learn and grow so that they can better achieve their goals and ultimately create lasting impact in their communities. Learning is central to all of our efforts here at the Foundation, whether it be through our reporting and evaluation processes, where our external evaluation partners and foundation staff will assist you in evaluating your program and providing feedback to help meet your program goals and objectives. Our communications efforts, which are designed to assist you in spreading the word about the positive outcomes of your program, which will support your sustainability efforts. Also through our dissemination efforts, where you may have the opportunity to work with our university partners, trustees, and foundation staff to distribute the key learnings from your programs so other communities might benefit from your good work. And lastly, our sustainability efforts to help you develop and implement plans to continue your program right from the start and throughout the grant cycle. Next slide, please. Over the past 10 years, our awardees have participated in numerous capacity and community building efforts. These efforts have included activities like learning forums where awardees come together to learn from one another and our university partners and foundation team about a variety of topics, including program reporting and evaluation, communications, dissemination, and program sustainability after the foundation funding has ended. Also, activities like peer mentoring, which I will speak to a little bit more in the next slide, and activities like access to educational resources, like the Foundation's Dissemination and Communications Guide and Effective Program Practices Guide, based on the learnings from our previous CCH awardees. Similarly, many of our current awardees have created their own educational resources in the form of program toolkits to help other communities establish similar programs. You might find these toolkits helpful in designing your own program, and they are also available on our website. Next slide. In 2018, we also piloted a mentorship program to pair long-standing awardees with newly funded organizations to help them more successfully launch their programs. We found this type of peer mentoring to be highly successful in assisting new programs to launch and meet their ambitious goals and objectives. And perhaps just as importantly, it's helped our new awardees to quickly feel part of a larger community of programs. This slide shows an example of a response we received from one of our mentees about the experience. Based on the positive feedback we received from our mentors and mentees, we plan to continue to provide mentorships as a valuable resource to our new CCH Next Generation Grant awardees. In a few moments, we will also share a video. Actually, we've already shared that video, but what you heard was from our current and prior awardees that this approach has had a lasting impact on their organizations. We hope that you find the possibility of becoming a member of our community of learners as a valuable resource to further build program and organizational capacity. Next slide. So as you heard, a few of the testimonials from two of our awardees, and as you'll note, each of them found our foundation's approach to philanthropy, grant making, and capacity and community building to be a positive experience for their programs and their organizations. So now we will have just a quick poll question for you if you could submit your response. And the question is, how interested is your organization in partnering with a funder like the AZHCF Foundation, who also supports creating a learning community and capacity building? Thank you for sending your response. And again, this is for foundation purposes to gather more information for our program moving forward, so we really do appreciate your answers. I'll now turn the program over to our board chairman, Dr. Jim Blassetto, to tell you more about CCH Next Generation. Jim.
Thank you, Rich, and thank you to everyone who is joining on this webinar today. As a cardiologist, I've seen firsthand how valuable community programs like yours can be in helping us address cardiovascular disease, a leading cause of death in the United States. Your programs as grassroots efforts serve as a first line of defense in helping to prevent and reduce risk factors for cardiovascular disease through such areas as educating community members, offering exercise classes, providing access to proper nutrition, screenings, medical care, but most importantly, motivating and empowering community members to change their behaviors and to take charge of their health. From 10 years of the CCH program, we've learned that the best programs are the ones that know their community Now, we recognize that one size does not fit all for improving cardiovascular health, and your approach must really fit in and be tailored to meet the unique needs of your community. So for that reason, we've intentionally allowed applicants flexibility in designing the programs that best suit their communities, from determining what clinical and behavioral measures to collect to setting their own program goals. CCH Next Generation will launch during Heart Health Month in February, and will be accepting applications online from 9 a.m. Eastern Time, February 3rd, through 5 p.m. Eastern Time on February 21st, 2020. Although much of the criteria from CCH will remain the same, we will be looking to fund organization in states with the highest cardiovascular mortality rates, and particularly in states where we have not funded programs in the past, as is outlined on this slide. For the next generation CCH, we will be accepting applications from organizations that have never been funded by the CCH program. We will limit one application per organization. The organizations will be able to apply for grant requests of $125,000 to $150,000 for a single year of funding. And the good news is that there's a potential for a second year of funding, which will be based on the performance at the mid-year mark. In terms of eligibility, again, we'd like to keep it simple. The applicant must be a U.S.-based nonprofit organization with 501c designation, public school, government entity, or municipal institution eligible to accept tax-deductible charitable contributions. Of note is that organizations that are 501c3 and are also an IRS-designated 509a3 are not eligible for funding. So if we look at what are the criteria that we are looking for the CCH Next Generation, these are outlined on this slide. And just quickly in summary, our focus is obviously on cardiovascular issues and is within the U.S. and its territories. We are focusing on programs that are addressing the unmet needs for CV health within their community, responding to the urgency around addressing these CV health issues, are working to improve the quality of the participants and the non-professional caregivers' lives as a part of the program, and demonstrate a clear plan for long-term program sustainability beyond the CCH grant. In addition, we look for innovative initiatives with clearly defined outcomes, measurable results, and processes, and these will be detailed by Dr. Jeff Osgood, who will speak more about the points in a few minutes. So shifting gears a little bit, as a result of the 10 years that we've had this program up and running, the lessons the foundation and our awardees have learned along the way, we have from that created an effective program practice guide to serve as a resource to organizations like yourself who are implementing health programs within your communities. Now, our evaluation partners, through their evaluation work, have discovered 6 innovative approaches commonly seen across our grant awardee programs. Although some awardees fit under more than one approach, our evaluation partners bucketed them into the one that best fits the program. These approaches are captured here on the screen and have been used as the basis for our effective program practice guide. Because these practices have been found to be highly effective in improving cardiovascular health at the community level, it is our hope that each of you will consider some of the lessons learned when applying for the CCH Next Generation grant. As each of you work to develop your programs, I thought it might be helpful for me to take you through the 6 innovative programs at a high level. Now, the application includes an opportunity for you to select one to align your program with, but we also are looking to say that a new approach or an innovative approach is something that we're always interested in. Now, the first innovative approach, as outlined on the slide, is leveraging access to uninsured, underserved participants to improve cardiovascular knowledge and health. Awardees exercising this approach develop program goals to help uninsured and underserved participants establish medical homes and access to care, and also educate participants about cardiovascular health and help them set and reach clinical goals. We've seen more than half of our programs incorporate access to care as part of their design. Oftentimes, these were clinics, health centers, or hospitals, but in some cases, they use other types of community partnerships to refer the patients for participants for care. These community partners can also be beneficial in helping to collect clinical measures. The second approach is bringing programs to participants. Rather than offering a fixed stationary location where the care was delivered, these awardees journeyed into communities to meet participants where they live or work or gather by holding programs at places such as food banks, churches, and other community sites, or by using a mobile clinic. If your community members have barriers to accessing transportation to come to some central location, this approach may be one that you want to consider to leverage. The third is educating children to serve as heart health ambassadors. In this case, these were largely youth programs where children were empowered to share their learnings with parents, siblings, or other adults so that they could benefit from the learnings as well. The fourth is improving cardiovascular health through food-based programs. For this approach, some of the awardees use food-related initiatives as a means to improve cardiovascular health of program participants and the wider community. These programs include such activities as nutrition and CV education classes, even growing fruits and vegetables, promoting a plant-based diet, increasing access to fresh fruits and vegetables, doubling the value of government-assisted nutrition benefits at farmers markets, or other things such as food coupons. This might be an approach to consider, particularly if you're located in a food desert where participants lack access to healthy food, and using this approach could help them meet their needs. The fifth innovative approach is using health coaches or promotories to improve cardiovascular health. Awardees using this approach employed health coaches to enhance the reach and impact of their programs and included efforts to help participants gain knowledge, skills, tools, and confidence to become active participants in their health and to reach self-identified health goals. This approach has been found to be very, very effective. And number 6 is providing culturally sensitive program interventions to maximize participant outcomes. Awardees who were able to successfully use this innovation were able to identify and integrate the unique cultural needs of their communities into their program design and delivery. This was an approach we saw in various populations, including Native Americans, African Americans, and Latino communities. Now that we've covered the 6 approaches, I want to explain how you can leverage the Effective Program Practice Guide to support your program design and maybe help you design a new and innovative approach. Now, over the years, we have learned how challenging it can be to launch a community-based program, and it is our hope that the guide will help remove some of the barriers and get you off to a very successful start. Our guide begins with a general overview for community-based health programs and provides lessons learned and based on learnings from that are based on our learnings from our grant awardees' most successful programs. We then divided the guide into the sections for each of the 6 innovative approaches that I just discussed, which includes things like lessons learned, effective program practices, common challenges, and tips for sustainability. For each, based on the learning from the grant awardees who used the program and who used that program's approach. We have also included information about the individual awardee programs using this approach and links to the awardee toolkits and other resources. Now, I just want to give you 2 examples to close with. This is actually a screenshot from the guide which looks at, again, the use of coaches and promontories to improve cardiovascular health, and focuses in on the program design and implementation. From this, you can see the effective practices that were outlined. I won't go into detail, but addressing participant motivation and individual care. This next slide, again, is in the same area of using health coaches as the innovative theme. And this talks about the common challenges seen. Again, not to go into detail, but to show you some of the information provided, data collection, program participant retention, staff turnover, common challenges that we're seeing with this approach. Again, we would encourage you that from the lessons learned that have led to the creation of the guide, encourage you to take a look, because there are many, many helpful hints of each of these innovative approaches within the guide. So with that, we're going to get to our second polling question, which is which innovative approach will your organization most likely align with when submitting an application for funding? Well, thank you very much for answering the poll question. The information is very, very helpful to us. So with that, I would like to introduce our evaluation partner, Dr. Jeff Osgood, to provide additional details on navigating the application and to review what a good application looks like. Jeff?
Good afternoon. Thank you, Amy, Rich, and Jim. Today I'm here to provide you with some helpful information and point you to other resources that we worked on to assist you in navigating the application process. Just in the beginning, there are a couple of needed documents that all organizations applying for funding through the CCH Next Generation Program are required to provide with their application during the open period in February. First, we need a copy of the current IRS Form 990 or other documents that establish eligibility to receive charitable donations. We like to see audited financials for the past fiscal year, but if they are unavailable, unaudited financial statements may also be submitted. You'll see on the slide a number of program design exclusions, what the foundation does not provide funding for, and these focus on things such as capital investments, media awareness programs or campaigns. Research or clinical trials are not at all funded through the CCH Next Generation Program or enhancement of existing hospital services. And just as a reminder, all these slides will be available to you after the webinar. They'll be emailed to all registrants. Also, the foundation does not support cardiovascular initiatives outside the United States or territories. We've had a number of questions come in during the presentation around whether or not applications from states outside of those with the highest incidence of CVD rates or mortality. And the answer is we welcome applications from all of the 50 United States and its territories. We don't accept or support program applications from individuals or for-profit organizations or religious organizations whose activities are not open to the general public. Again, we accept applications from religious organizations so long as those programs are designed to be open to the general public, and we do not accept any applications from organizations that discriminate on the basis of age, race, ethnicity, religion, national origin, gender identity, sexual orientation, marital status, military service, veteran status, or disability. So we are seeking programs with solid program designs that are focused on measurable results. So in the program or in your application, we are going to need for you to clearly define and designate outcomes, measurements, and processes. We're specifically looking for programs that clearly define the clinical outcome goals they're seeking to achieve, and we're looking for outcome goals that include standardized tests such as the PACER test, the Progressive Aerobic Cardiovascular Endurance Run test. We're also seeking programs that are leveraging an innovative approach. So as Jim spoke to earlier, we have provided an effective program practices guide that is available to all of you at the AstraZeneca Healthcare Foundation website. But we define innovation very specifically here at the foundation. We are looking for programs that are leveraging a program design or strategy that is innovative for a particular target population or even geography. So it's not that we're looking for the leading edge of program health writ large. We are looking for programs that are designing their interventions in ways that are innovative for the target population and target geographies. And also, we're looking for programs that are focused on sustainability. We are hopeful that this funding will provide the foundation for a successful and long-term life cycle of your program. So we're looking for programs that are thinking about sustainability beyond the potential grant period funding, and you'll have an opportunity to speak to those sustainability strategies in your application. So in terms of measurable outcomes and participant goals, we require that all submitting organizations have program designs that are targeting at least a goal of 400 unduplicated participants by year end. And again, we want these programs to be designed to reach at least 400 unduplicated participants by year end. And they must also be designed to track at least 200 unduplicated participants by year end. What we mean by track is participants in the program who have at least one baseline and one follow-up measure that allows the organization to demonstrate the change in clinical or behavioral health by the grant program year end. Also, the programs must ensure that in their design they are showing an ability to demonstrate measurable outcomes at both the mid-year point, which is March 2021 for this grant cycle, and at the year end, November 30th, 2021. And the programs must also have a design that demonstrates that they will have met at least half of the goals by the mid-year point of the program year, which is March 2021. Here's a helpful timeline to talk to you about this entire grant, the CCH Next Generation grant cycle. So we will do the call for applications beginning February 3rd at 9 a.m. through 5 p.m. February 21st, 2020 during Heart Health Month. The foundation has a multi-tiered grant review process that occurs from February all the way through July when the board makes its final funding decisions. In August, we will expect successfully funded organizations to launch their program, provide a 3-month report due in late October, a mid-year report in April of 2021, and then the grant year ends November 30th, 2021 with year-end reports due early December. And as Jen spoke to earlier, those organizations that are making good progress at the midpoint have the potential for a second year of funding that will be confirmed based on their performance at mid-year. So here's some elements of a good application. In terms of cardiovascular need and goal, we are looking for program applications that clearly state a program goal that identifies an unmet cardiovascular health need using specific and relevant county, regional, and national data. These data must be specific to the county or region where the project occurs. So if you're serving a population in a municipality within a county, state-level data, while helpful to demonstrate that there's an urgent med need in the state, we are looking for programs that are identifying the data that is most closely associated with the target geography of the program. Data should come from sources such as the Centers for Disease Control and Prevention, the Behavioral Risk Factor Surveillance System, or state or county and health departments. If a study or article is cited, it should not be the only source of data, and data from previous programs are also welcome, but they should be in addition to data such as the CDC data. So here's an example of a well-stated cardiovascular need and goal. This is a program that is focused in Johnson County, which is in Northeast Tennessee. So as you see here, the example demonstrates that the applicant has identified the rank of Tennessee in terms of heart disease mortality rates, but also talks about the incidence rate within Johnson County where the program will occur, and it provides additional data on diabetes prevalence and physical inactivity and the adult obesity rate for Johnson County. So this example provides a very solid communication of the urgent and unmet need where the program will occur, and that's what we're looking for in program applications. One of the critical parts of the CCH Next Generation program is the recruitment of participants. Because we have very clearly defined minimum thresholds that must be met in terms of 400 reached participant by program year end and 200 tracked participant by program year end, programs must start the recruitment process early on in the program life cycle, especially right after the funding announcement has been provided in August. And so not only should there be a clear path towards recruitment, but there should be a clear definition of what success looks like in terms of these measurable outcomes and a clear plan for tracking progress towards the goal. Programs should be very careful not to overreach or under-deliver. And these are things, your program goals should be based on your annual budget, your infrastructure, your capacity, and your ability to deliver program results over the 16-month program cycle. So here's an abbreviated program design timeline. And what this example does well is it demonstrates that in the early periods of the grant, the 16-month cycle, the program will seek to finalize the program partnerships and locations and the recruitment and training of staff in the very early months of the program's life cycle in August and September. And then in October and December, they're already recruiting participants and they're collecting baseline measures because they know that by March, they're going to, and between March, April, and May, they're going to need to meet the half of the planned tracked participants. And in early May, they're going to need to also continue to seek to identify the follow-up measures for those participants being tracked. So this is an excellent abbreviated example, and you can see additional information in terms of an example at the sample application located online. Again, we're looking for outcomes and not outputs. Outputs are critically important, but we're looking for programs that maximize the benefits to participants. So while outputs are direct products of a program, they're usually measured in terms of what work has been done. This in terms of meetings held, screenings accomplished. We're looking for outcome goals that clearly identify predicted changes or benefits resulting from the program as measured against its goals. So a good example of this is an X percentage or point reduction in blood pressure or body mass index. Again, here's another example. So instead of indicating that participants will decrease their BMI, a good application will indicate that at least 80% of participants will decrease their BMI by at least 10%. So we have the number of participants we're aiming to hope to see the magnitude of change indicated here. So part of the CCH Next Generation program is a requirement that we include clinical outcome goals or outcome goals from standardized testing. Behavioral outcome goals may also be provided, but we're looking for clinical outcome goals. These clinical measures must be collected by a healthcare provider or a trained community health worker, and they cannot be data that are self-reported from the program participants. And we strongly prefer an outside evaluator to assist programs in evaluating the efficacy and outcomes of their programs, though we welcome applications from organizations who have internal program evaluation staff, insofar as they are not involved in the program's operations, management, or delivery. So again, we're looking for programs that are going to be sustainable after the funding period, and so in the application you will have an opportunity to identify sustainability activities that you will be working on during the 16-month program grant cycle. This includes acquiring additional grant funding or donations, conducting fundraisers, sharing the program with other organizations, developing program toolkits, and disseminating results in publications or conferences. And in fact, I'll talk a little bit more about resources that we have available to you in terms of program toolkits that have been designed by our current awardees. Again, we're looking for innovative program designs. We're particularly interested in program designs that align with one of the 6 innovative approaches that Jim spoke to, and they can be found in the Effective Program Practices Guide. You are also welcome to identify your own approach that may be based on your own experiences within your locality. Again, these are innovations that include new and unique processes and practices specific to the program or specific to a target population or geographic location. So again, we have spent a considerable amount of time summarizing the learnings that we've identified over the 10 years of funding from the CCH, the Connections for Cardiovascular Health program. And as we launch into CCH Next Generation, we wanted to provide these resources to you so they can be a benefit as you design your programs and apply for funding during Heart Health Month. So online, we have the detailed program criteria that outline eligibility and other requirements that are necessary for seeking funding through the CCH Next Generation program. We have an application question preview. So this is a very helpful document, even though the online system doesn't go live until February 3rd at 9 a.m. We encourage you to look at the application question preview. You can begin working on your application now, and you simply cut and paste from the application preview into the online Benevity platform. We have a sample application that further provides the examples like the ones we've discussed today, and we encourage you to look at that to better identify what types of answers and submissions we're looking for. We have a number of frequently asked questions documents available to you. We have the FAQs about the CCH Next Generation program in general available online at the Foundation's website. And then we also have FAQs about the application that are provided in response to emails that are sent to the CCH mailbox. You will receive an auto-generated email with a link that will allow you to continuously reference an FAQ document that we'll be updating throughout the entirety of Heart Health Month. So some quick reminders. The 2020 CCH Next Generation program will be providing funding and will be providing grants for organizations seeking funding between $125,000 to $150,000 for a single year of funding. But as Jim said earlier, those programs that are performing at the mid-year point will be eligible for a second year of funding. In terms of the who, we're looking to fund programs from organizations that have never before received funding from the CCH program. So I want to be very clear. We are looking to fund organizations that have never received funding from the CCH program, not states. We had a question about that earlier as well. So again, some quick reminders. February 3rd at 9 a.m., the CCH Next Generation application opens, and the link will be posted on the CCH website. On February 21st at 2020 at 5 p.m., the Next Generation application closes. We strongly encourage you to submit your application well before the deadline, as technical difficulties are not a reason for an extension to the program, the grant application deadline. Between February and July, a multi-tiered grant review process will go underway to select a number of applicants to recommend to the board for funding in July. The vast majority of applications will receive a notification in April if they are not selected. And again, those selected for funding will be notified in July. Again, here are some additional resources and contact information. So for more information on the CCH Next Generation program and application, please refer to our Foundation website for the detailed criteria document, FAQs about CCH Next Generation, the application preview, which will allow you to start on the application process now, the sample application, and the effective program practices guide. Again, a link to the application will be available on CCH webpage on February 3rd, 2020. And again, here are some of our ways to stay connected with us on social media, where we push out additional information as the grant cycle progresses. So here's our last poll question for you today. We'd like to know if the webinar helped you in better understanding the CCH Next Generation program and its application requirements. And as a reminder, we will be providing this entire slide deck to all attendees via email. Please go ahead and answer the question. All right, thank you so much for participating in that poll. Before we open it up to some questions and answers from the participants, I have a quick question for Jim. Jim, why is the Foundation launching CCH Next Generation?
Well, launching the CCH Next Generation comes down to really two areas that were, again, this was discussed within the board. After our current 10 years, we saw the impact that the programs were having within the communities. But we also saw that there were areas that within the country that have not had programs funded. So we made a decision that first we wanted to focus on areas with the highest rate of cardiovascular mortality, and secondly, again, focus on states where we have not had programs funded in the past. The second is, and again, it gets back to the innovative approaches and the practice guides. We have a lot of lessons learned and what went well, what didn't go well from the programs that have previously been approved. So again, we made a decision that on the CCH Next Generation, we would fund programs that have not received previous funding. Again, with the hope here that we would be able to have a broader reach and to apply the information that we've acquired from our lessons learned to a group of programs that have not received previous funding from the AstraZeneca Healthcare Foundation. So that's really the nidus of why we went into CCH Next Generation.
Great, thanks. All right, we're going to take some questions from the question and answer box now. So some of the questions we have a question around the question was, the grant call said that we will not fund research or clinical trials, but seeks projects with measurable results. What is the difference between research and measurable results? In terms of research, the research exclusion, so that would be kind of a classic experimental design where you would take your participants and break them up into two groups, and one group would receive an intervention or receive the benefits of program, and another would not, to try to better understand if there's a statistically significant difference between the two populations. So a traditional experimental design would not be something we would support. That's what we mean by the research design exclusion. We are looking for something that is more looking to maximize the benefits to participants and not establish a body of knowledge or theory. And what do we mean by reaching 400 people? So again, when we talk about reaching 200 tracked participants, these are individuals who will have a baseline measure and follow-up measure for at least one clinical outcome, though we encourage all programs to collect a baseline and follow-up for all measures. When we talk about reached participants, these are participants who may come into contact with a program intervention, so they may attend a nutritional education session, but you've not collected a baseline measure for them or a follow-up measure. And so that would be somebody you reached with the program information, but you've not tracked actual clinical or behavioral data from them. Okay. Colin, we have some questions around indirect costs and what's available.
Sure. So for the budget, there's no limit on the percentage of the budget that may be allocated toward indirect costs. The intent is to maximize benefit to the participant, and each application will be reviewed with that in mind.
Great. And can you discuss the budget model?
Sure. So program budgets can include indirect expenses, salaries for personnel and contractors, program materials, printing, office supplies, phone and fax charges, travel, training, dissemination efforts, and the costs associated with evaluating the program. Beyond this, there's no specific guidelines except that funding for budget expenses funding for equipment must be less than 30% of the total request and integral to the program design. We also don't fund the purchase of vehicles. And the other line item is also limited to 10% of the budget. And lastly, any budget expenses allocated for healthcare provider compensation must only support a portion of each healthcare provider's annual salary for their work on the program, and can't be in addition to their annual salary for the 16-month grant time frame paid for by the applying organization.
So a question again, Colleen, several people have asked about paying for staff. Are staff salaries permissible under the program award?
Yes, staff salaries are permissible under the program grant award. We don't put a limit as to the total percentage of the budget that can be allocated towards staff. We recognize at the foundation how valuable staff are to implementing the program, so for that reason, we don't put a limit.
So we have another question, like what other documents besides a 990 could a government entity upload to show we can receive charitable donations? And so, for example, we've had a Native American tribe submit their federal recognition documents as one of their documents demonstrating their ability to accept charitable donations. So there's a question around where specific communities fit within this program. Again, we are a program that is focused on serving underserved populations where there's a high urgent or unmet need. And so programs that focus on populations that have been underserved are very much encouraged to apply. Yeah, so there's a question about clinical and behavioral outcomes. So we're a program that very much focuses on clinical outcomes, and I'll hand it over to Jim to talk about it a little bit.
Well, again, we're looking to see that the impact of the program has, again, your programs are grassroots efforts, and what we're looking at is what is the impact that you set up front that you were going to do have as an outcome, and B, what happened with that outcome. So we do have clinical outcomes that are part of the programs. We also have behavioral outcomes that are part of the program that we can look at, say through follow-up questionnaires around behavioral changes or tracking or if there's dietary changes, those types of things. So either or is acceptable from a standpoint of seeing what the impact of your program implementation had relative to either clinical or behavioral.
Great, thanks, Jim. So there was a question about about the differentiation between external and internal evaluators. So the question was, can we receive clarification on the evaluation portion? They believe that we said that internal evaluation was possible, but those internal evaluators must not be involved in the program. That is correct. So we're looking for someone who is, the internal evaluator can be someone who is affiliated with the organization, but they must not be directly involved in the programming. So of course you will have somebody assigned to the program who will be helping to collect and analyze those results, but we're looking for somebody external to the program to verify those results through an evaluation process. So we have a question around proposing multiple programs, and at this point we're accepting one application from each eligible organization. Multiple applications are not accepted from a single organization. So Colleen, there's a question around the clarity around salary support. Are we making a distinction between healthcare providers' salaries not being eligible for funding and program staff salaries being eligible for funding?
No, so both healthcare provider and non-healthcare provider salaries may be covered.
There's some questions around if anybody will be available to answer questions prior to the grant release date. So what we're trying to do as a foundation, as questions come in, to the CCH mailbox, we'll be updating the frequently asked questions document that you can access at the link that you'll receive via an auto-generated reply to the CCH mailbox. But we are also, as time permits, responding to individual emails as we get to them. There's a question around accepting or requiring letters of support by community partners. At this time, you can reference those letters of support from community partners in your application, but there is not a way for you to upload them, but you are more than welcome to discuss those letters of support in your grant application. And yes, if you represent an organization that has not been funded, but an organization in your community has been funded, you are still eligible to apply for funding. So can we talk more about the strategies we have found that have helped sustain the program after the grant period? Joyce, would you like to talk a little bit? Okay, we'll talk a little bit about the strategies that have been helpful. So we've seen organizations put together program toolkits that have helped them go to key stakeholders in their community to secure additional funding, whether it be from the state legislatures or county governments or local health departments, or it's helped them through fundraising campaigns. Some of our organizations have used their sustainability plans to go on and to scale up their programs at additional locations.
You know, another area around sustainability is an important aspect is around dissemination of your program and the impact that your program is having. I mean, if you're successful, other people want to see what the success is, and the dissemination, and again, some of this will be answered with other documents, but dissemination by any means, whether it's and we've had some of our programs that have had results published or been at meetings and speaking, or even at the within their local areas, just disseminating the important information around the impact. Everyone wants to see positive impacts, and that helps from a sustainability standpoint.
Yeah. So again, there's a quick restatement. Did we just say provider salaries can be covered as well as staff salaries? The answer is yes. I just want to answer the thing that might be providing some of the lack of the clarity is we don't accept applications that are focused on exclusively providing funding for healthcare salaries. So an application that would just be funding cardiologist salaries would not be accepted. So again, we do accept program applications that includes a budget for healthcare provider salaries and staff salaries. There's another question which is really important. Does an institution qualify as a single organization? So we're getting this question from many universities. Yes. Even though there are multiple departments, colleges, and schools within a university, we accept one application from each organization. We expect that the universities will have an internal way of identifying which application will be submitted. No, this webinar will not be offered again, but we will be providing the slide deck and a link to the recording after this. Since you registered, you will be a benefit to it. So no worries that you joined a couple minutes late. No problem whatsoever. Says, will there be an ability for funded organizations to receive more than 2 years of funding? At this point, we can talk about is that at the mid-year point, if programs are meeting their program goals and are successful, then a second year of funding is possible. All right, so we will continue to endeavor to answer these questions that are in the Q&A box. Again, in a moment, Amy will provide you with some last minute information, including ways to connect with us.
Thank you so much, Jeff, and really to each one of you for your really active participation in today's webinar. We really hope that this webinar helped to answer some of your questions and that you will consider applying for a grant next month. As we already talked about, if you have remaining questions, please feel free to send us an email at that email address on your screen. And then, as Jeff already alluded, there is an FAQ document available as well that would be a good resource for you as well. Please stay tuned for a follow-up survey from us. And just a few more housekeeping information. During the actual application process, should you have any technical questions, please reach out to our online service provider, Benevity, at grants@benevity.com. You can also click on the Need Help link in the top corner of each application page to call up an email form, which will be sent directly to Benevity. And again, really, in this last remaining moment, we really do want to thank you, and we appreciate your interest in the CCH Next Generation program. Really, and finally, best of luck with your applications.